morning. Thank you for having us here today and hearing from us. We echo Mark Jewell's statements to the plan staff, particularly for having involved all of the stakeholders all the way through this process. That being said, here we are, and in the interest of the time, I'm going to have to be more blunt than I might like to be, or even than I normally am. We are here, as far as we see it, because in February, there was an attempt to shove through a plan that didn't have answers, a plan to address the sufficient measures clause in the budget we've all been talking about today. This board, in its wisdom, didn't adopt that plan, and instead was going to get more answers from the legislature as to what sufficient measures meant. To date, we've just been told there has been no clear answer as to what the legislative intent of that clause, sufficient measures, meant. We don't see how you could do anything more today than you could have done in February and do it in good conscience. With all due respect to the governor's budget, taking $71 million from reserves because an undefined goal has been unmet is completely unrealistic. It's wrong, and you should not do that to state employees and retirees. I'm part of the plan. I'm sorry that happened to y'all, that you don't have a definition of that. But unfortunately, that means, in our opinion, that you should push harder. When you finally wrote in April, asking in writing for the legislature to define sufficient measures, in our opinion, you probably wrote about 6 months, maybe 8 months too late. The minute that budget was passed, there should have been a distinct effort to find out what it meant. In April, when you wrote, you didn't say define it. You said, if we made these changes, would that be okay? It's been my experience when you offer things up to the legislature, when you offer up pain for anybody, they're going to take it. We would have preferred to see you ask, what do we have to do to accomplish this goal? There's still time to ask that. And budget writers on the House side, we've been talking to them all morning. I'm sure everybody in this room has. They're still trying to figure out what they're going to do. It's premature to act, just as it was premature to act February 5th. We're almost there with the budget process.
Having sat in your shoes at one time on the State Health Plan Board of Trustees, and I've heard some good discussion today, and Mr. McKeithen, thank you for some of the questions you've asked. But as I look at the board members, my question to you, can any of you today explain to this audience what types of out-of-pocket cost increases have occurred to plan members over the past 5 to 6 years? Will anyone volunteer to do that? Do you think the materials before you today, do you think the materials you have seen previously provide you with insight as to what the plan benefit changes mean to the average plan member? I would suggest they do not. Repeatedly, you receive a lot of information, but no detail on what the impact is on the plan members. Again, you've heard staff argue, well, basically it's been improved and plan members aren't paying more money. Don't ask the plan members that question because they will refute that totally. It is 20% of $1,000 is far less than 20% of $1,500. And your plan members have basically not been given pay increases. So yes, as a percentage of net income, they are paying more today for their health insurance and their benefits than they have ever paid in the history of state government. Now, SEANC urges this board to delay your vote today and to demand some information on the benefit changes and the cost per plan member per year, the cost in aggregate to plan members for the benefit changes that have been made. And if you are going to be pushed into taking a vote today, and I urge you not to do so, I would urge that you consider eliminating the plan that has been the one least chosen by your plan members. Employee Benefit News has repeatedly had articles how
30 seconds.
Thank you. How people are not being educated on CDHP and high deductible plans. So we would urge you, eliminate that plan if you're going to eliminate one, reallocate the health reserve account funds back to the 80-20 and the 70-30. Thank you.
Thank you, Bill.